Welcome to St. Boniface Hospital. In the heart of this hospital is a group of amazing people that do such incredible work, and we really want to introduce maybe a little glimpse of what they do. We are now in St. Boniface Hospital's Heart Failure Clinic, and I have Tia Provici's, I guess, little savior, in a way, Dr. Shelley Zieroth, who is the medical director. First of all, Shelley, I've known Tia for so long, and to see her go through this change is totally, totally wonderful and incredible.
She really has had quite a remarkable journey, and she's taught all of us a lot going through it with her. And I think she's going to teach a lot of people in the public and bring up the awareness of heart failure in the community as well.
Well, we'll get into more on what you do here as a group, but Tia now, how bad was she when she first came to you?
Tia put on a brave face and looked beautiful throughout her entire illness. But it was clear on interviewing her and examining her that she had significant symptoms and limitations related to her heart failure diagnosis. And it was up to our team to help improve those symptoms, and she's actually come a long way.
So, okay, take us through, I guess, the regular routine that you had to do with Tia.
Well, she first presented to our heart failure clinic a number of years ago, and she was assessed by our interdisciplinary team, where we have nurses on the team, doctors, pharmacists, physiotherapists, and we kept following her in clinic. We did some phone visits with her as well, and we optimized her medical therapy. And after that, we referred her for a special heart failure pacemaker, which really has played a significant role in terms of improving her symptoms.
Now, how often, Shelley, does Tia come back here, and now her, she's made such great progress? Where do you go from here?
Well, she's been following us about every 6 months or so in heart failure clinic now that she's doing better. And where do we go from here? Well, we hope to keep her symptoms stable, and that she can continue to live a long, happy, healthy, and very productive, energetic, and vibrant life that Tia does.
And I guess, will she, along the lines, Shelley, need a heart transplant?
That is a possibility. Our goal in this clinic is to keep everybody with their own heart as long as possible. Heart transplant is a treatment, it's not a cure for heart failure. You take a whole bunch of other medications, and there's other risks with it. And there's not a lot of donor hearts out there. So our goal is to stabilize as many patients like Tia as possible, and when the need for consideration of heart transplant comes up, we'll be there with her.
You must go through so many amazing journeys here. I see there's so many people here right now, and we know that heart attack and heart disease is #1 killer for women over the age of 50, as great an increase now for men. So how do you just keep yourself, I'm the doctor, you're the patient, dealing with life and death?
I think it's perhaps our heart failure team is a little different than other teams. It's a chronic disease, and we go through a journey with the patients, and the team is very important in getting each other and the patients through that journey. There are good times and there are bad times, and I often refer to it as a circle of life, is what we see every day in this clinic.
And what do you think of Tia now?
Tia, it's not a medical term, but Tia blows my mind in terms of what she's accomplished and how gracefully she's gone through the illness. It was certainly a journey for her as well to get to where she is now. And I think a lot of people can learn from her journey.
Well, thank you so much for sharing this time with us, Dr. Zieroth. I know you're very, very busy here. We can only say from the bottom of our hearts, we are so thankful to have such an incredible team right here in our midst. And really, I'm getting all teary-eyed because I've known Tia for so long, and thank you for saving her.
You're welcome.